Anybody outside? Okay, time is over, okay? Come in.
So we are going to start.
Okay, good afternoon. Okay, we continue to afternoon conference. So this afternoon the speaker is Dr. Peilin. He is I think everybody knows him. He's very famous for the pain specialist. He earned a master's degree in 19 University TCM and in 1988. Then he almost a teacher, the foreigner student in 19 TCM. And also he visited many countries, did a lot of lecture, and he published several books. Most book title is for the pain treatment for acupuncture. So, okay, welcome to Dr. Peilin.
Thanks. I will take this 40 minutes as opportunity for me to share my experience. And I hope this time I'm not going to disappoint you. The title of this lecture is about pain relief with acupuncture. Of course, I have heard different story about treatment for pain with acupuncture. However, my question is that, is there standard or routine way to treat pain with relatively good result? My answer is definitely yes. So I want to share my experience today. So usually, pain is a sign. It means something is going wrong. However, in classical medicine, usually GP or specialist, sometimes they can find the reason. However, in most cases, they can't find any reasons. Therefore, the last sentence from GP is that you have to live with it. So, in fact, this is a disturbance to our life, especially for our mentality. Therefore, I'm not agree with this kind of a final conclusion that we have to live with pain. 小徐啊，你过来一下，我这个屏幕能大一点的，这屏幕太小，我看你不戴眼镜，这个太……哦，我懂了，这看不了的，我要看这个问题。好了，我懂了，好了，谢谢你。Okay, I'm sorry. Yes, too little.
Yeah, you stand here.
No, okay. Stand here.
Follow this.
Okay.
Yeah, you can stand over there.
Yeah, stand over there.
Yeah, I can stand. But here's the microphone. Okay, never mind.
Okay,
never mind. Okay. Never mind. It's okay. But okay. Usually I don't need. We are coming back to the original point. First, discuss about the origin of the pain. We can talk nothing else about the etiology and pathology. And it is true that we can use some points to treat pain successfully, but if we don't understand the etiology, then the pain will come back. So, what you know, the etiology about pain can cover different aspects. For example, what we often see is, as what we see here, usually is due to our own fault. Except sometimes we have pain due to falling down, physical traumas, etc. But in most cases, it is our own fault. Why? Because there's something wrong with your own life. Even, for example, starting from your daily activities. For example, in Belgium, a lot of people like walking in the rain. They found it's fresh. It's kind of a challenge. But I say, it's kind of a pathological changes invading the body. Therefore, I say try to avoid it. And in Belgium, for example, in Netherlands and in Luxembourg, what we call is Benelux. The climate is almost the same, something like that in England, humid, cold, and windy. As what you know, that this situation is exactly a good opportunity for invasion of wind, cold, damp. The question is that, is everybody suffering B syndromes in Benelux or in England? The answer is no. Why? So it means that underlying factors is a determining factor, which is antipathogenic qi. Therefore, our antipathogenic qi is important for pain relief. In that case, if there is external wind cold invasion, people say, oh, it's nonsense. You're talking about, again, wind cold damp. Yeah? But don't forget, this term expression was formed a few thousand years ago. I give you an example. Here, Lyme disease. Do you know Lyme disease? It's quite popular. Lyme disease. It's caused by the bite from the tick, leading to infections, bacterial infections. However, in the beginning stages, what the symptoms we have found is wind, heat damp, or toxic damp, toxic heat, etc. Yeah. So if you only think about that it is due to a bacteria, and you say, oh yeah, TCM can do nothing about this infection, that's wrong. So people, if a good practitioner of TCM try to improve their resistance and also improve the elimination of wind, damp, and heat, and the symptoms will be covered. I will talk later on. In Belgium, Benelux, many people are suffering from B syndromes. Is there any shortcut way to treat them? Answer is yes. When wind, cold, damp, etc. are not eliminated in proper time, the coming step, the consequence is that hiding pathogenic factors in the body. For example, a lot of disease can start. B syndrome actually is also due to a hiding factors which was not properly eliminated and completely. In this case, if the pathogenic factors stay in the body for a long time, for sure, it means that our anti-pathogenic factors is low. Therefore, we have now two tasks to deal with this pain. First is to support our anti-pathogenic factors. The second is to eliminate the pathogenic factors at the same moment. Another disease we often encounter in our practice is what's called fibromyalgia. It is a disgusting disease for a lot of specialists, neurologists, GP, etc. But look at the symptoms in the beginning of those two diseases, and you will be puzzled that they're exactly invasion of external pathogenic factors. And then when the patient came to your practice, and they're still suffering from the external invasion. Therefore, afterwards we were going to talk about how to recognize external pathogenic factors which are hiding in our body. Can we still use some simple technique to eliminate them? And the answer is yes, but we have some technique to learn. Okay. So here is the list of the symptoms from this fibromyalgia. TCM was formed a few thousand years ago. Yeah. At that moment, they discovered when pathogenic factors stay in the body, no matter how long, how deep it is, they still show some symptoms. Therefore, the TCM called syndrome differentiation. It means that sooner or later you will show some symptoms. For example, fibromyalgia, yeah, or Lyme disease. When they come to you in the later stages, usually they suffer from muscle pain, and with extremely tiredness. At these stages, if somebody who have learned Sanghan you know that this is Taiyang and Shaoyin syndromes, which means that combination of different syndromes. There is one symptom is muscle pain, sensitive to weather changes, and the pain is especially at the superficial of the body, which is Taiyang syndrome, especially Taiyang wind cold syndrome. However, but then extremely tiredness, and people have somnolence, people want to sleep, and they will still feel tired after 10 hours, 12 hours of sleeping. For example, people also have some other disease, then we call Taiyang and Shaoyin syndromes. And if at this moment we suppose only going to use acupuncture, our weapon is too weak, then it's not enough. You use some points to eliminate the wind cold damp or to support the Zhenqi, to support the yang of the heart and the kidney. That's too weak. We have to use some herb medicine. I'm going to also discuss afterwards. Talking about the wind, wind is indeed one of the pathogenic factors. Say, yeah, wind we can prevent, indeed, but the wind invade the body, you will have big problems. Yeah, it's often attacked people who have liver problems. Look at the people who are living in Westers. A lot of people suffering from wind. So who are going to suffer from the external wind invasion? The people who have liver wind. For example, if I'm very, very nervous myself, I will sooner or later quickly get invasion of external wind. So external pathogenic factors only invade the people when they have an internal pathogenic factor existing for a long time. And cold. Cold seems that one of the main factors invading the body, but not only from nature, but through many different channels. For example, from our drinking. For example, this midday, the water the restaurant provide is ice cold water with ice blocks, which is for us is terrible, terrible. And also raw vegetables, uncooked vegetables, those different things. Pay attention. I will always ask my patient to pay attention to different pathogenic factors, not only to their pain, but also to the origin of the pain. Okay. Usually damp is another factor which due to climate humidity. And this is one of the factors existing in Belgium. So people living in the area, for example, at this moment, too much humidity in nature, very bad factors. So you can see that some people, old people especially, that they're coming with pathogenic factors invasion. For example, that they feel cold, they feel heavy. They not only have one place of pain, but they have multiple places of pain. And if you ask them about the house isolation, usually those are poor people. I found it's very poor, that they have not sufficient central heating system. The window is not closed, single glass, the house is built in the shadow, etc. They're too bad. I remember when I was 40, I could tolerate cold, tolerated humid very much. But one time I got a lesson by myself. Because one period, about 3 years ago, for example, I was renovating my house. And they used a lot of new cement, etc. floors. And I was suffering from different joint pain. So I suddenly realized that that's terrible. That's the humidity, which is the main cause. And one day my camera, I have also good camera, but not so expensive as Dr. Sun, suddenly broken due to humidity. Simply, I was taking photos and it's broken. It's a good camera, it's just 1 year old or 2 years old. It was due to the shortcut of the maybe the circulation of electricity, something like that. And when I was young, I could also feel that I don't feel any cold. However, I gradually feel I need warmth. I need more and more warmth. So I start to build a house. Not living in the practice, but I build another house. Not to show that I'm able to build a house, not only for my house. For my house. I built a house situated towards the south, especially with big glasses to receive a lot of sunshine, etc., which are important. Okay, now I'm going to show some importance about combination of the causes due to external invasions. A lot of cases of the pain are caused by these factors. First is that Taiyang and Shaoyang syndromes. Indeed, Taiyang syndromes, as you understand, headache, muscle pain, etc., and throat pain. However, Shaoyang syndromes, some people maybe ignore it. For example, people feeling warm, feeling cold and warm, feeling irritated, feeling neck tension, feeling sometimes down, but they are all Shaoyang syndromes. Shaoyang syndromes. It's not necessary to have all of them at the same moment. However, as predicted, as indicated in the Shanghai Lun, it says only one of the symptoms is sufficient to diagnose it as Shaoyang syndromes. So in this case, if we still doing some points, points to relieve the external invasion is too soft, too weak, we have to go to the Shaoyang syndromes. For example, we have to use the points from Shaoyang meridians, at least. It is by adding or without adding these points, the efficiency is significantly different. So that are the common syndromes that we often see. We continue. Okay. Now, Taiyang syndromes is simple. Sometimes we don't see so typical symptoms. However, one of two symptoms is sufficient. For example, people say, yes, I still have pain. If it is windy, I am feeling pain. If it's cold, I feel pain. So it means Taiyang symptom is still there. By understanding these syndromes, we have to add some points. Very simply by, for example, large intestine 4, triple 5, lung 7, for example. Very simple. However, if syndromes stay so simple, everybody can be a good TCM practitioner. We don't need to run the course of 5 years. Only 1 weekend is sufficient. The complication goes on and on. For example, Shaoyang syndrome you have mentioned, typically like this. However, one of two symptoms like this is sufficient. At this moment, we have herbs, we have also acupuncture. But if we use some acupuncture, then we use some gallbladder channel. The points from Sanjiao, for example, what we often use, I often want to use is gallbladder 34, gallbladder 40, gallbladder 20, etc. It's interesting. It's interesting. Now, these syndromes, what we often see is also another interesting case that with Shaoying syndromes. Shaoying syndrome means involvement of spleen and stomach, especially spleen, weakness of the muscles, muscle pain. For example, a lot of cases, even later stages of Lyme disease, is fibromyalgia belong to these syndromes. What can we do? To warm and to eliminate, to support the spleen. Okay. The most frequent syndromes in fibromyalgia and Lyme disease belong to these syndromes, Taiyang and Shaoying syndromes. Because you can see that they're extremely tight. And and this tiredness is abnormal, that when they sleep after 10 to 12 hours, they still feel tired. So this is one of the typical symptoms of Shaoyin. Yeah. Here there is a formula, I cannot write here, but if I mention the name of the formulas, you can easily, quickly recognize it's Ma Huang Fu Zi Xi Xing Tang. Very simple, on 3 herbs. Does it work? Yes. Please try this formula. I don't know if it's the foods or Xixing is allowed in Great Britain. Not allowed? It's luckily in Belgium it's still allowed. Yeah, it's still allowed. Probably it's also not allowed in America. Xixing?
Xixing, yes.
Yes, Ma Huang not. Fu Zi?
Fu Zi, yes.
Fu Zi, yes. So if you miss Ma Huang, for example, what is the herbs you are going to relieve Taiyang syndromes? It's a big problem. It's a big problem. But if you miss the foods and Xixing, then it's a big problem to release the Shaoyin syndromes. So therefore, we do need some herbs. Talking to the herb company outside, and he's going to provide us a good quality of herbs from Phoenix. I have asked some few questions. I'm very satisfied with his product. Okay, Jueyin syndromes. Jueyin syndrome, some people think that is not often seen. However, it's quite often seen as well. The symptoms I have listed already. Good. After this is external invasion, now we come back to the internal factors. Internal factor actually is also simple for everybody sitting here. Internal including emotional, including diet, including constitutional, etc. I have nothing over to say. However, in most cases, people ignored these internal factors. For example, the food, diet. When I arrived yesterday at the airport in Manchester, I took lunch there. And surprised enough to say, I'm not satisfied with the British lunch, or it's a bad conclusion. Why? So I ordered a dish, and then which is containing chicken meat, so little bit rice and vegetable. I think it's a complete balanced food for me. So when the dish was served, I was so astonished. Why? They only provide about maximum 10 grams of vegetables. I said, is that a British meal for me? They say yes. I say, okay, I cannot say nothing. So I finished it, and I ordered another dish of a vegetable salad. Again, it's raw. They don't have no special good food, cooked food. So these things, if I, day after day, year after year, eating like this, I will be weak. I will be surely weak. Because the food, the vegetable is not cooked. Yeah? You can have some raw vegetable, but not in this way. You do need some vegetable, but not so little. It's average, we need about 350 grams to 400 grams of vegetable per day. So you can imagine. I believe a lot of people here living in Europe have eaten too little vegetables. Amazing, too little. So this is also fundamental causes for internal imbalance, I believe. So I start to change the diet and also emotions, also constitution, etc. are very important. So if a patient arrives, we try to make an analysis. Okay. Internal cause usually has its own characteristic, low starting, long duration, etc. Which we also have to recognize them quickly and solve them completely. Okay. About emotionally disturbance, this is another factor which causes a lot of pain. I don't think people are living poor in England, in generally speaking. However, but they're living poorly in emotions. Emotion that means that they are depressive. They are sad, no, but they can be very, very disturbed by various kinds of emotions. Yeah. So emotion is one word, however, it contains different contents, all kinds of, and also the complication is there's often mixture of different emotions. So without regulation those emotions, and then we are blocked. The pain will come back. For example, even frozen shoulder, what we often see, is related with often is sadness. Sadness. Because the evidence is that the pain is mainly along the lung meridians. So if you go deep, ask, do they have some emotional disturbance? They will say yes. So suppose if you only use some point to relieve the pain, the result is quite poor because you cannot touch the real cause. Okay. Now about the treatment, I'm going to touch the final point about treatment. Actually, treatment with acupuncture is consisting of different methods. Not only using acupuncture, however, we have to use some different the therapies related with acupuncture. I'm going to show. About diagnosis, we know our way, as everybody sitting here, they are quite qualified. Okay, so those are simple. There's normal procedures. Some people take a little bit longer to observe those changes, 4 methods of diagnosis. Somebody take less time. However, they are the necessary procedures we have to follow. Then what's important is palpation. Palpation is that if you are practicing acupuncture without these procedures, you are wrong. I must say you are wrong, or I'm wrong. Because then you don't know which meridian is involved. And then you don't know which point you are going to use. Okay. So we have different points, different location to prepare it. Ashi point, Baksu point, etc. There are some rules to follow, especially according to people's complaints, also according to your way of thinking, and also according to internal relation of the organs, and also to see some observation, to see any changes about discoloration, look changes. They are missing, showing some external symptoms, external signs. You will never see a patient say, I'm healthy, but I have pain. It's impossible. It is impossible. There are different pain injury diagnoses. We have different terms of diagnosis according to etiology, pathology, places, etc. This is not important. We are going, due to time limitation, we are going to cover most interesting points. Okay. Actually, for pain relief by acupuncture is consisting 2 steps. One is stop pain. Second is to eliminate the cause. Yeah. So the painkillers in classical medicine is only in most cases is a pain relief. However, it doesn't really relieve the external relieve the cause. Okay. We have a different way to relieve the pain. I here listed the 4R. Relieve the pain as much as possible, etc. As quick as possible, etc. So the meaning is that we have to use all our weapons to relieve the pain. Okay. What are pain to relieve the pain? So as quick as possible, but not as fundamental as possible, as quick as possible. To show effect of acupuncture, we have a way. Those points are important. They are what we call the symptomatic points. Due to time limitation, I will going to give you experience quickly. The low points is very important, but it's only relieve the pain, superficial pain. Superficial, not deep. The end point, that's most for chronic pain. or pain with large areas. Those yuan point, low point are selected according to the location of the pain, according to the meridian involvement. Xi point are the point especially to treat acute pain, or chronic pain with acute exacerbation. Su point is for joint pain, for example, B syndromes. We have to use some Su points, the Su point, which is the third. Okay, Ashi point. Okay, Ashi point. Don't think about Ashi point. Is a very simple symptomatic treatment, but it's important. It means this place, people who have pain, is the indication that there's heavy qi and blood stagnation. Okay. This is also a technique which can be used to treat the pain as quick as possible. We can consider this group of a combination as symptomatic treatment, not fundamental treatment. So some people, for example, after falling down, right, and for example they hurt the elbow, right side, and they have a bandage, they have swollen, they have bleeding. You are not able to puncture locally. However, you can find some corresponding points at the knee, and this knee must be at the same side, or vice versa. If people have pain in the knee injury, they can find injury or pain sensation at the elbow regions, which we call the fundamental corresponding places. Interesting. Okay. For this very quick treatment, people can give massage, give acupuncture, etc. Okay. Now, after the symptomatic treatment, the pain is relieved. We have to go to a little bit deeper to recover, to repair the injury. For example, Lyme disease, fibromyalgia, there's already injury. We have to recover. Now, to recover, we have to use the yuan point as a main point. The yuan point is a yuan point. And also other points. Okay. Other points are including those points. 5 Su point. Not all 5 Su points used together. For example, this person has pain due to emotions, especially due to anger, a lot of anger, frustrated inside. So you have to use the points, back Su points from the liver, and also from Mu point from the liver, which is liver 14, for example. So those points are selected correspondingly according to the cause. And also be very, very familiar with the combination of modern sound technique. So now you have seen that acupuncture treatment for pain relief is not simply put needle in, different way of a point combination, which is very important. Okay. This picture and also the picture I show next are interesting. This is also a kind of a 5-element point selection according to 5 elements. For example, if people who have some problems in the, we take an example. Okay, we take lung disease. Lung disease, if this is due to deficiency, we have to tonify the mother of the lung, the metal, which is the lung 9, right? The earth point, because lung belongs to metal. But meanwhile, we also have to tonify the mother organ, not only the points from the lung meridian, but also the mother organ, which is the spleen. But in spleen, on spleen channel, we have also a point belong to the earth, which is spleen 3. And meanwhile, we also have to control the elements which over-control the metal, which is the 5 points. For example, to not to provide any chance for the heart to over-attack the metal, etc. Okay. This is reducing, and also following the same way. When organ is in deficiency, in excess, we have to treat this organ and to treat related organ. Okay. In most cases, it's due to chi blood stagnation. So think about this chi blood circulation point. Okay. Now, another way, we have the way to treat the pain by using point to quickly control pain, and also to treat chronic pain by using the points to eliminate the causative factors. But now another way is interesting, calming the sun. During operation, what happens? After people receive the anesthesia, people sleep. Doctor can operate, can remove, can correct. So at this moment, the sun is sleeping. Sun is sleeping. So it's not reacting. So due to this medication, they blocked the sun. However, TCM also has the same way to block the sun. A few years ago, I went to Australia, and only lectures for medical doctors, especially for hospitals, anesthetists. They say, Dr. I want to show me how you can prove that by using the calm sun that people feel quiet. Because acupuncture can be used for anesthesia, as I will show you. So, because they are anesthetists, they want to see how acupuncture can stop pain immediately. So I show you just few points for calming the sun, and the pain start to diminish greatly. But calm sun is not same like the sun complete sleep. Normal operation, there's people feel sleep completely. But when the sun is calmed, so people are not reacting to the pain completely. But this is only symptomatic treatment. So the cost effect is still existing. Okay. Now points to relieve, to calm the sun are listed here. Different points. Reducing, please. Reducing. Because in any case, the sun is disturbed. Shall we use all of them? No. 2 or 3 of them is sufficient. Reducing. And we also say we can use these points first to give some release, reduce. And then you put the needle in, and if people feel different. So some people say, yes, after your treatment, my pain is much better. But the pain can be back. I say, yes, because I have used different points. But you have to show you evidence of efficiency. After people coming to you 10 times, the pain is still there. So they don't have trust to continue their treatment. So we have to obtain our effect within 1 or 2 times treatment. Pain control. So they feel, oh, it works. But it takes time, I understand. I have Lyme disease already for 4 years, but already it's better. But after 5 times treatment, 10 times treatment, nothing improved. So they will not come back. Okay. Now, if we stop here, it's not sufficient. There's a lot of supplementary treatment. Don't forget, the more method you are going to use, the better efficiency is supported and strengthened. Okay. So there are different things to use. Acupuncture is not only one technique to be used. Many different things. Just think about this. And you use different methods at the same moment. One interesting thing is called 小针刀. 小针刀. 小针刀 is application of sword-like needles. Probably you are afraid of using this, but the mechanism is very simple. So they use these sword-like needles insert into the ashi point, only ashi point, or some related area which has nodulation, which has deep pain. So, and then up and down, left and right, and then cut off some tendons, cut off some ligaments, so the pain will be released. So even you're afraid of using 小针刀 because 小针刀can cause some scar formation and painful. However, you just use some acupuncture needles. but you use the same mechanism of application, left, right, up and down, 2 times the effect is the same, little lesser than 小针刀, however, leave no scar formation. And if possible, then you use a combination of 2 of them is sufficient. Good. So this is conduction of my lessons. Probably it's too quick. It's big topic, and I have to cover it in 40 minutes. Now it's the time for you to raise your questions. Please, gentlemen. Our colleague, yes, from Portugal, yes. Please.
I would like to make some questions.
Please.
According to what I understand, you start to do the differentiation in the 4 to 6 meridians.
Yes.
Later on, you start to talk, it's a question of concept. You start to talk about time level. This is the first. I want to know what you mean by level and why you don't use time meridian.
Okay, okay.
Another question is, you talk about Chiclet points. There is some distinguish between yang meridians and in-meridian Chiclet points you use. You do that to see that difference, yes, when you use that.
Okay.
And later on, you said spiritual balance. Are you talking about Chen balance?
Okay, I will talk. Yeah, I will answer. Fine.
It's a question of concepts, you know.
Indeed,
it's
very
very
important.
important that we have the concepts very clear.
Good, good. So I will answer your question one by one. First is about the Shaoyin syndrome. Okay, so meridians or Shaoyin syndromes in different levels. But this is not meridian. It's not meridian syndromes. It's organ meridian. Because meridian never shows that people have an extremely tired, feeling cold, feeling aversion to cold. No, it's not meridian. It's the organ, internal organs. That's why you can see the tongue extremely pale, etc. Okay.
So, but what is your concept of level?
What
means level?
Level, oh yeah, okay. Which it means that external pathogenic factors, when they invade the body, they usually take different level, step by step deeper. However, it is always same that they pass through all these 6 general levels. They sometimes can, for example, at Taiyang syndrome stay very short time, 1 or 2 days, then immediately go into the Shaoyin syndromes. It's very possible. This syndrome is not the meridian, but it's organ.
Okay. Just let me tell one thing. Are you talking level concerning the severity of disease?
Disease, not meridian.
You are talking of level just concerning the severity of disease, or you say there is different levels of the meridians in the body?
No, it's not meridian. If they use these meridians, just the same. Just use the same as a meridian, but they don't use that meridian. It's not a meridian problem. Because when we talk about the Yangming, for example, we have Yangming meridian, but we also have Yangming organs. But most of it we're talking about the organ disease. Okay. My second question about emotional problem. Emotional balance. Emotional balance is
is the translation.
Yes.
Spiritual balance. You are talking about Chen balance. This is a concept that must be very clear. What you mean here with spiritual. You know the meaning of the word spiritual? Yeah, spiritual.
Do you mean that it's that we are balancing the sun? Sun, yes. Sun actually is a big word, of course.
Yes.
It's not only the heart, however, it is rooted in the heart, however, related with different organs, but not only with the heart. For example, people have different emotions. We have to treat the heart as well as some related organs too, but rooted in the heart. Okay. And then, third question?
I was talking about Chiclet points.
Chiclet point.
Distinguish yang meridians from in-meridians.
My own experience is...
I use the acute pain, okay?
Okay.
You use both yin and yang meridians for acute pain, the Chiclet points, Or you distinguish?
No, I only use the points. For example, the meridian which are involved. For example, people have shoulder pain. Yeah. After examination, they found, oh, it's in the large intestine, or it's on the lung meridian. Then we use these points only on the Shiklev points, for example. Only use. I don't need to use the other meridians. No, it's not same like traditionally they use the yang of yin meridian. I only related organs. I only use. For example, yeah, people have for the hip pain, it have a radiation, herniation, for example, radiating to the gallbladder meridian herniation between the 4 and 5. Yeah. It's radiating to the gallbladder meridian, so we have to use the low point of Shiklev point, etc. But okay.
Thank you very much.
Thank you for the question. Any other questions? Pain is, of course, it's quite a big topic. So if we can manage pain in our acupuncture practice, we can have very big, successful practice. It's quite an interesting topic. Okay, any other questions, please? No, no especially. Okay, but okay, please.
I'm quite interested in the session that you talked about how this emotion could be related with the pain. So could you please give us a specific example that acute or chronic pain that is closely related with emotion changing? Thank you.
Yes. It's also quite interesting how also it's quite big, of course. Emotion, as you know, including different aspects. Not only anger, but frustration, fear, worry too much, thinking too much, sad, etc. But TCM put them simply into 6 kinds of emotions. Fine. So when people came here, people can have different situations, and different emotions can have influence of involvement of different organs. For example, people with a fear. Who people have a lot of pain due to fear. Those people have a lot of anxiety, fear, afraid of failing something, lack of confidence, and you will see they will not have good strong kidney. You will see they usually have different kidney symptoms, and then in these cases you regulate their internal organs, and then emotion will be better. And meanwhile, I also use some Endpoints. For example, bladder 52, for example, together with the heart points, because heart is the root controller for different emotions. So actually, you will have to analyze the different pain with different emotions. The difficulties is that there's usually a mixture of different emotions. If people say, I have fear, I fear that I'm fail examination. Yes, okay, you have a lot of tensions, etc. But usually there's different emotions, mixture, at least 2 or 3. Then you have to grasp which is the main emotions, but then rooted with the heart. Try to regulate the heart. The points that I have listed, very interesting, reducing, to calm down the emotions. Okay. Do you still have time, or time is over? Time is up.
If somebody has one more question, it's okay. If no question, we take break. Okay. Do you have any question? Okay. So now we take a break. 20 minutes.
Thank you.
Yeah.
Thank you.
Thank you for Dr. Sun.
Thank you.
20 minutes. Please come back.